Hi. Wow, it's so good to see that you're awake. Excuse me, I'm just getting a pair of gloves on here. It's good to see you. When I came by earlier, you were resting, so I told your nurse that I would come by a little later on in the day. I'm glad to see you're kind of up and around. How are you feeling? Okay. Still having a little bit of that dizziness. Okay. Well, my name is Dr. Perez. We spoke on the phone before you were admitted. I'm glad you made it safely to the hospital. While I'm here, I do need to go ahead and get your general inspection done. So there is an assessment I need to perform. It's called an HEENT. Essentially what that is, it's just an assessment of your head and kind of neck area and your eyes, ears, nose, and throat. Because of the nature of your injury, these are things that I will be needing to assess on a regular basis. So for today, it's important that we get a baseline of your health overall and kind of what's going on, especially since you're still having some of that residual dizziness, which does concern me just a little bit. Yeah, a little bit of pain as well. Okay. And the pain is still kind of in the same area, or it's radiating a little? Okay, so kind of towards the side. Okay. And is it just on the one side? I know before you came in you said that it was kind of going back and forth a little bit, but it was more on the one side. Okay. Well, I have a couple of things here, and I think it's important that we go ahead and get started. So is it okay if I start with just kind of a basic general inspection? I just want to look you over a little bit, have a look at your face, assess for some symmetry and things like that. Perfect. Okay. Let me just have a look. Okay, so excuse me, I do have my Penlight here, and I apologize, it is a little bit bright, but I do want to have just kind of a general look at your head. I won't be shining it in your eyes just yet, okay? So if I could have you just kind of keep your head midline for me. I am going to just have a look overall here, so just briefly shining this on your face so I can get a little bit of a better look at your skin. Okay. Good. Okay. So, externally, I'm not seeing anything that appears to be abnormal. Yeah, so it doesn't look like you have any like lesions or abrasions or anything that's visible to the naked eye on the outside, which is good. That doesn't necessarily mean that there's not anything going on the inside, but we'll kind of have a little bit of a better look as we go along, okay? All right, so let's go ahead and move on. I have a couple things, and why don't we go ahead and start by testing your eyes. With the dizziness, are you experiencing any like sensitivity to light? No? Okay, so me shining my light, it shouldn't bother you too much. Okay, if it does become too uncomfortable, I do want you to let me know. The light is pretty bright. I want to have a good look at your pupillary reaction, but I don't want to make you uncomfortable. So if it starts to cause you any pain, please just let me know, okay? Okay. Okay, so I'm gonna have you just look kind of straight at me here, and let's see. So I'm just gonna be shining this right now. Nothing, just having a look in your eyes, kind of in general. So just keep looking at my nose. I know it's a little bit uncomfortable. A slight delay here. Still doing okay, not causing you any kind of extreme discomfort, right? Okay. Interesting. So I think I'm noticing just kind of a slight lag. Is that something that you had prior to this injury? That's new. Okay. Can I have you keep your head midline but kind of look up for me? Good. Okay. Interesting. Okay. Okay. And then I want you to look down with your eyes but keep your head straight. as I come just a little bit closer. Okay, and you can just kind of look right at me. So I'm going to do a little bit of what's called the swinging light test, and essentially that means I'm just going to swing my flashlight back and forth, and I want you to just keep looking at me, okay? Perfect. Thank you so much. Good. You're doing such a good job. I know this can be a little scary, but you're doing great. Okay. Just last little bit here. Good job. Okay. So, like I said, there was a little bit of that lag, more so in the constriction versus dilation. So that's something that I'm going to note. Can I have you kind of follow my light? So I am going to shine the light here, and I want you to just follow it with your eyes. Try to keep your head as midline as possible, okay? So here's my light, and I want you to follow with your eyes. Good. A little closer. Good job. Any discomfort with that? Are you experiencing any double vision or like blurriness? Any floaters or like spots of light? No? Okay. You do a little bit of a wider scope here. Good job. No discomfort so far? Everything feels okay? Okay, so I'm going to do that kind of the same. This time I'm going to go on like a rotating motion. So just keep following with your eyes, okay? Yeah, perfect. Out. Then we're going to go close, close, close. I want you to just follow that in for me. Good. Again, close. Follow it in, follow it in. And it gets a little blurry as we come in closer there. Okay. Okay. So I think that's why I'm noticing some lag kind of here. Okay. Okay, I'm so sorry. Did a very good job with that. Something that we're going to need to pay attention to, and actually, since we're having a look at your eyes, I'm going to just kind of gauge pupil size. Since there was that little bit of lag between the two, I do want to see if we're kind of symmetrical as far as size and measurements goes for each eye. So if I can have you just look straight at me, and I'm just going to hold this up here, and I'm going to do, let's see, 6. About the same. I would say you're about the same, about a 6 on both sides. So not too much of a variance there, which is great. Okay, so the next thing I want to do is move on to your hearing. So your nurse told me, just kind of on a conversational basis, you're able to hear things regularly, which is good. So in this conversation that I'm having with you right now, I haven't noticed that you're having any issues understanding me. Do you feel like you've had a hard time? No? Okay, perfect. So I would say at a baseline, your hearing is probably within normal limits, but let's go ahead and do the general test anyway. Okay, so I'm going to have you just kind of slightly turn your head, and I just want to have a look in your ear to begin with, okay? So let me see. And I will be touching you. I hope that's okay. It's just, I just want to have a little feel of your ear. Noticing anything, any pain or discomfort as I touch here? No, that feels okay. And if I pull just slightly, that's okay as well. Okay. Good. So if I can have you turn your head the other way. Perfect. Okay. And also not noticing anything abnormal here on this side. Is this uncomfortable at all, me touching? And then kind of pulling, that's not uncomfortable. That's okay. Okay. Perfect. So externally, as far as your outer ear canal, I'm not noticing any excess earwax production or what I would call cerumen. There's no discharge kind of seeping to the outside of your ear. You didn't say that they were causing you any pain. So let's go ahead and move on to the hearing exam. So what I'll be doing to start is actually just making like a slight noise on either side. And I want you to just kind of gently raise your hand on the side that you hear it, okay? Perfect. Good. Okay. Good. Good job. Okay. Perfect. Both sides. Good job. A couple more. Okay. Good. Both. Good job. Okay. So good job with that. I am going to do one other thing as far as testing your hearing, and I have a little device here. I know it looks a little weird. It's just basically an eyedropper, but this is going to produce like a light puff of air sound, and I want you to just tell me if you can hear it, and if so, what side. So this time I want you to just say yes left or yes right if and when you hear it, okay? Perfect. Good. 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 Okay. Good job. Good. Perfect. Okay, so you heard all of those. Very good job. I'm not guessing that there's anything wrong with your hearing. You did very well there. So if anything should come up and you feel like the dizziness is kind of having a negative impact on your hearing, please let me know and we can do some further assessments. But for now, I feel like at baseline your hearing is perfectly fine. Good. Okay. So let's move on to your sensation. And I'm going to be doing kind of a basic sensation exam. I have a couple things here. These are little silicone tips, and I'm going to be touching your face with this kind of in various areas. So you might feel just like a light tap or a swipe, and I want you to just say yes if you feel it, okay? Perfect. Okay. So you're going to have your eyes closed, yeah? Mm-hmm. Good job. Good job. Good. Okay. Did this. Good. Good. Okay, so you were able to feel all of those. And again, for your sensation, this time we're going with something that's a little more obvious. So I have, this is actually an acupressure tool, but it is spring loaded and it has kind of a flat, cold tip. I'm going to be using various kind of points of pressure here. It'll either be really soft or maybe a little harder, and I want you to just say yes again when you feel it, okay? So eyes closed for me. Perfect, okay. Good. Good. Okay. Just a couple more. You're doing great. Good job. Okay. So you did get all of those correct, and I'm not seeing that there's anything kind of outwardly wrong with your sensation. Okay, very good. So let's go ahead and move on to the test of your nose. And for this, it's going to be very, very basic. All I want you to do is occlude one of your nostrils. So here we're testing the patency of your nares, which basically means I want to see if you're able to breathe out of both sides individually, okay? So I want you to block off one nostril and breathe in for me. Good. Good job. And do the other side. Just block off. Good job. Okay. And this time I want you to have your mouth closed. Breathe in deeply through both nostrils. Good. And did you notice anything abnormal there? I didn't hear any occlusions. Felt pretty basic, pretty normal for you. Good. Okay, perfect. So let's go ahead and move on to the test of your head. And basically for this, I'm going to be doing a couple palpations, and I'm also going to be using my reflex hammer here to kind of do a light tapping around your head, and this is just going to help me assess for any abnormalities, okay? Perfect. So let's start off actually with some palpations or just kind of feels around your head. So you're welcome to close your eyes. I am going to be touching your head, okay? All right. So let me have a look. Not seeing any abnormalities. Let me know, obviously, if there's any pain here. Okay, so nothing notable. Not noticing any scarring or any obvious defects. Good. Feeling the top of your head. Can I have you just tilt your head down like that? There you go. Perfect. Okay. Just having a look at this side. I'll look kind of over here. I'm not seeing anything. Okay. Anything that I would suspect is kind of looking. Okay. Good. Okay. Any pain or discomfort with that? Everything felt pretty normal. Okay. So like I said, I'm going to be going in with a couple taps, and I want you to just let me know if this causes you any discomfort, okay? Okay. No pain there. Good. Okay. This side. One more kind of on your chin. No pain or discomfort with that either. Okay. Good. So now I want to test your jaw, your mouth and jaw. So if I can have you just open your mouth for me, I'm going to be shining my light. So just kind of say, ah. Good. And Stick your tongue out for me. Good, okay. And can you move your tongue to one side and then the other? Good. Okay, and then try, you're not going to be able to, but try to put the tip of your tongue at the tip of your nose. Very good, okay. Perfect. So nothing notable there. Tonsils appear normal in size. I'm not noticing any discoloration or abnormal secretions. It doesn't appear that you have tonsil stones, and uvula is midline, okay? So I am going to have you open and close your mouth. Good. And can you do that again? One more time. Just feeling for your mandibular bone here. Good. And not noticing any issues with TMJ. Do you notice that you have any clicking or kind of abnormal clicks or lock in your jaw when you're eating or yawning or anything like that? Everything is pretty normal for you. Perfect. Okay. So everything with your jaw appears to be okay. So let's go ahead and move on. I want to do, let's see. I want to do just a couple last things as far as testing your strength. So if I could have you turn your head, so you're going to turn like this. I'll have my hand here, and I want you to try to fight against my resistance. We'll do that on both sides, okay? I'm just going to have my hand here, and I want you to, good. And we'll do the other side. Any pain or discomfort, especially on the side where you said you were having some pain earlier? No, okay. So you're going to go up, and I'm going to do the same thing. So kind of try to push, good job. And then again, down. Good, good, okay. And then if I could have you do the same thing with your shoulders. So I want you to shrug your shoulders for me, and I'm going to try to push them down. Good. Okay, and then just your arms. If you could extend your arms for me, I want you to push up. Okay, and then down. And then if you could pull towards me. Good, and then push. Good job. Okay, so I'm not noticing any abnormalities in your strength or kind of depth perception. You were able to move accordingly, which is good, which is appropriate. So the last thing I want to do is I have my stethoscope here. I apologize, it is cold. It's cold in the room, I know. I'll try to warm it up for you a little. Okay, so what I'm going to do is have a listen to your heart, and I want you to just breathe normally. So kind of widen your shoulders, have a couple normal breaths, and I'm just going to be placing this on your chest, okay? Good. Normal breaths. Good job. And normal breaths. Good job. Okay, do the other side. Good. Now this time I want you to take in a deep breath for me and hold it if you can. Good. You can breathe out. Good. We're going to do that one more time, okay? So deep breath and hold it. Perfect. Okay. All right. Well, the good news is I'm not hearing any abnormalities. I didn't hear any kind of murmur or tremors. Heart rate was within normal limits for you to just be sitting, which is good. Active heart rate, we would want to see a little higher, but you've been resting, so obviously I would expect it to be a little bit lower. So as far as your pain, do you think you're going to want anything for pain overnight? Do you want me to add anything to your MAR that the nurses are able to give you if you're having kind of breakthrough pain? Okay. So pain level, do you think you'd need something more like a Tylenol or something more like an Oxy? Do you want to meet in the middle and I can do like an extra strength Tylenol? You think like a regular Tylenol will probably be fine. Okay, so I'll make that available for you, let's say every 4 hours. So that is a PRN medication, which means you'll need to ask for it. So make sure you're letting your nurses know when you're in pain. They will do a pain assessment every few hours and ask you. But if they're not asking you and you feel like you're having that breakthrough pain, make sure you're letting someone know. If for whatever reason that pain medication is not enough for you, definitely let your night shift nurse know and they can page me and we can add something a little bit stronger, okay? Perfect. Well, thank you so much. It was so nice to meet you, and I will see you again tomorrow morning. We'll kind of redo the assessment and see if you've made any progress, okay? Perfect. I hope you have a good night. Thank you so much.